Thank you, Dr. Curry. First Five Fresno County was the agency that commissioned that African American infant mortality report, as we are the agency that promotes and supports the healthiest start in life. We have sister agencies in every county in California, and we use tobacco tax dollars to invest in programs, in services, and in efforts that aim to improve the lives of young children and their families, and most especially of our most vulnerable babies. So soon after the report recommendations were presented that you just heard from Dr. Curry, we knew that the heavy work to put strategies into practice was just beginning, and we at First Five knew that we couldn't do it alone. And one of those strategies quickly rose to the top, and that was group prenatal care. We learned the University of California, San Francisco had just launched the preterm birth initiative, and group prenatal care was of interest to their work, along with Fresno County, given what you just heard in terms of our statistics. So the partners that you see on the screen are our main partners that came together, because you can imagine the challenges that come with the idea of establishing a group prenatal care option for women, logistically, financially, community buy-in, et cetera. But all of these folks came together as a team of stakeholders, including PTBI, or Preterm Birth Initiative with UCSF, Fresno State Central Valley Health Policy Institute, which was the organization that had led that African American infant mortality report. Payers like Calviva Health, which is the Medicaid payer here in Fresno County, and women with lived experience, along with First Five and many other stakeholders wanting to bring something like this to Fresno County, to see where a strategy like group prenatal care could take us in terms of addressing some of what we heard from moms. So UCSF, the Preterm Birth Initiative, funded the development of a group prenatal care program, and First Five, along with the Central Valley Health Policy Institute, took the lead in developing the program with input from community partners and some financial support from Calviva Health. So let's see, next slide. So GLOW was born. GLOW is a group prenatal care program, and the name GLOW came to highlight the glow that we wish to see in every pregnant woman. So it's a program that involves 8 to 12 women in similar gestational age that receive their prenatal care together. So imagine you go to your prenatal session, and instead of just going by yourself to the doctor, you are in a group setting. And all of these women offer each other social support while actively participating in their care. And they have patient-led conversations related to health education. So there are between 8 to 11 group sessions, each lasting between 90 minutes to 2 hours. And in between, or in that time, there is opportunities for check-ins with their medical providers, one-on-one check-ins. But the most time is spent in a group setting discussing a variety of topics critical for a healthy pregnancy. GLOW used the centering pregnancy as the foundational model for group prenatal care, and these models, all of these group prenatal care models, at their core involve the following things: social support among participants, which may reduce stress and improve symptoms of anxiety and depression during pregnancy; improved patient-provider relationships to build trust and encourage women to voice concerns. There's a session specific to postpartum mental health concerns, which ensures that the topic is actually discussed and addressed at least once during pregnancy. And then the patient-led dialogues that are facilitated during sessions that allow for more frank discussions than in individual patient-provider conversations. Patients usually are less comfortable mentioning sensitive or stigmatized topics in a one-on-one setting, but they feel more comfortable bringing them up when other participants raise similar concerns. And the picture here that you see is an actual session of GLOW. Next slide, please. So the GLOW program also included some wraparound services for all participants, keeping in mind all of the social determinants of health that we had also heard during the AIM report. So there's childcare provided for any toddler or preschooler or sibling that accompanies mom, nutrition education and distribution of groceries at each session to promote healthy eating. There's transportation vouchers to address the lack of, easy transportation to get to and from the doctor's offices. So we provide vouchers to participants. And then absolute mental health, wellness, and mindfulness activities and referrals whenever necessary are part of the curriculum. And social support, that was the biggest thing, was to make sure that women felt comfortable together in this setting. And there's also referrals to programs that are part of our public health system here, like WIC. Next slide. I'll give you a minute to take a look at some of what we heard from participants. Once GLOW was in full gear, the program makes me feel more comfortable about my pregnancy, my baby, and my nutrition. It has been really great to be able to hear about the experiences of other moms because it helps with me not feeling so isolated. This isn't something that Black women normally talk about, so it's helpful to have a space to discuss this topic that we aren't exposed to. GLOW has helped me be more interactive in my pregnancy, made me love my partner more. Everyone that participated in GLOW had glowing things to say about the program, and most importantly, the social support component continue to come through, that it really takes a village to have a healthy pregnancy. Next slide, please. So here is a program history. As you heard from Dr. Curry and I, GLOW came about after the African American Infant Mortality Report, making it one of the recommendations as a strategy to address what we were hearing. In 2017, GLOW was born using feedback from the community, along with crucial collaboration from many of the stakeholders that came together to make it happen. The feasibility study of GLOW began between 2017 and 2019, and participants confirmed that it takes a village to support a healthy pregnancy and that it was making a difference. And in 2019, First by Fresno joined UCSF and the Central Valley Health Policy Institute at Fresno State once again to figure out how we could take GLOW to a higher level of comparing a group prenatal care model to individual prenatal care. That is the most common option, so that we could reimagine what it would mean to have group prenatal care be an option for all moms, not only in Fresno County, but across the state and hopefully across the nation. And I'm excited for all of you to hear more about that from Dr. Cooperman.